You know, dropping a few pounds is a common New Year's resolution.
Yeah, for a lot of people. For those who have shed a significant amount of weight, there's something that's called body contouring. It may be necessary to remove the excess skin.
That's right. So Marshall Health Surgeon Dr. Rahman is here today joining us to talk about this procedure and kind of let us know what is next at this point. So first off, you know, welcome. We're glad to see you here today.
Thank you.
Yeah,
My pleasure being here.
Yeah.
Thanks for having me.
So describe body contouring. A lot of people might not know exactly what that means and what it entails.
So body contouring aims to restore a person's natural body shape or contour, and that's after pregnancy, significant weight loss, or even just the effects of gravity and aging. And so when you look on someone who underwent pregnancy, for example, they have significant excess skin in their lower tummy, separation of their muscles, often drooping or loss of volume of their breasts.
Yeah, it's hard to have a baby.
It is.
It's not easy.
I was going to say, everything changes on your body after you have children. So who would be good candidates for this type of procedure?
So if we look on the two populations, so people who have undergone significant weight loss, whether through diet and exercise, so-called lifestyle modifications, or through surgical weight loss. And at Marshall, we have a bariatric center of excellence with our robust bariatric surgery team. Many people have begun this process. Many people are now at a point where we can help them complete this process. If they have achieved a stable weight, their goal weight, and this has been the case for 6 to 12 months, definitely they should come see us and discuss their options. For people who have been pregnant that have the effects of pregnancy on their belly, their breasts, or elsewhere, you know, this is what we call a mommy makeover typically, and that involves that tummy tuck, which tightens the muscles, removes that excess skin, and uses liposuction for contouring and removing that little excess fat. For the breasts, a breast lift operation with or without implants to add volume. Those are standard for a mommy makeover operation. And then with the weight loss population, generally we see a bit more excess skin in the arms, the thighs, the face, the neck.
All over the body.
All over the body. And so surgeries, both the tummy tuck and breast lift, but also arm lifts, thigh lifts, and face or neck lifts really helps them, you know, become the best version of themselves.
Self-esteem.
Restores confidence in themselves and their bodies.
Key right there.
And I think another thing that people think about it, you know, if you have bariatric surgery, you're already in touch with the surgeons, and you already understand before you even have that surgery that you'll need possibly that follow-up to have that skin taken care of.
Absolutely.
But for people who have gone through weight loss maybe over the course of time, they're not in touch with those people. How do you reach out to that population?
You know, an effort that we're making now is collaborating with the bariatric team here, both the surgical side and the side that helps with diet, exercise, lifestyle modification. Let them know that these are options available to them. You know, start getting these discussions happening early, and then hopefully, you know, once they've reached their target weight, you know, and that's also something they can work towards, knowing that this is another step to get them to their final goal and completing their aesthetic and weight loss journey.
How long does recovery take?
So it depends to some degree on what they have done. If you have a tummy tuck operation, usually that's the longest recovery because of all the muscle work that we do. We're thinking 2 to 3 weeks before you're back to light work. For arms, thighs, breasts, within 2 weeks you're usually back, and after 4 to 6 weeks, usually you're able to go back to full activity.
The field itself is growing, and it's interesting. How did you personally get involved in this?
Well, so, you know, my background, I did my general surgery training at the Mayo Clinic and here at Marshall University, and my plastic surgery training at Vanderbilt University, and kind of deciding to go into plastic surgery. This is one of the few surgical specialties where a single surgeon can make a tremendous difference in a community or entire city. And so there's a lot of appeal there for me. And also my decision to come back here when the skills I acquired at Vanderbilt, I knew I could make a significant impact here in our community, especially with the bariatric and post-bariatric population that we have here.
I'm sure they're happy to welcome you back.
Yes, absolutely.
And patients too, I would think too.
So welcome back to the area.
Thank you.
We're happy to have you back.
Thanks so much for coming in here today and sharing what you're doing. We've got your contact information on the screen in case someone wants to maybe come in for a consultation or check with you all about, you know, maybe the journey they can go on.
Yeah, because the phone call's free, and so is the consultation. You can come in and talk to Dr. Barry or somebody else on the staff.
That's right.
That doesn't cost cost you anything, and it's good information because you might figure out, you know, what you need. So,
Right. That's
yeah.
right.
Thanks for coming in.
Thank you for having me. I hope this was informative for everyone.
Yes,
Terrific.
thank you.
Absolutely.